Good afternoon, everyone. Thank you for joining the Community Forum Co-Creating Community Center Emergency Action Plan event. This is 2 of 3 events that we are holding from 5 to 6:30 this evening. The next one will be October 25th. And so just want to introduce what the community forums are. It is a platform to increase awareness of the Emerging Pathogen Project and to engage community members and organizations in dialogue and actions relevant to preparation for pandemic/emerging pathogen before, during, and after it occurs. The overall purpose of the forum is to bolster the country's preparedness and capacity to respond to emerging pathogens during medical and public health emergencies. So next slide, please. So I just want to introduce a little bit about who CCPH is, Community Campus Partnerships for Health. Our mission is to promote health equity and social justice through partnerships between communities and academic institutions. We are a small but a mighty nonprofit that works with institutions, community members, non-traditional organizations, for example, homeless shelters, and our main goal, again, is to promote health equity, social justice through research and community engagement. Next slide, please. So we want to start with the icebreaker. So please put in your chat or come off mute and provide your name, your pronoun, what's one lesson you learned about pandemic response. And I forgot to introduce myself. My name is Keisha Vines. I'm the engagement specialist at CCPH. So I'll be the face of leading these forums with you guys. So please put into the chat and introduce yourself. Nice. Pandemic response is not a one-size-fits-all. Yes. Things that were not possible before pandemic became possible during a pandemic. I agree with that. Health is not political. Wow. We saw a lot of that in the news when a lot of news outlets were making wearing masks or getting the vaccine a very political thing. But just as a reminder that it is not political. Health is for everyone. Health is wealth. So yes. Learn to adapt. I learned that if we work together, we can achieve more. Yes. And then outbreaks and only once communities are engaged and have a voice in the response. I agree. Thank you guys for sharing. We can go to the next slide. Let's see. So I want to go over the agenda for this evening. So first, we're going to talk about the RESPECT project. So our partners at the UNC Chapel Hill will give you a brief description of what the RESPECT project is, who they are, what their mission and goals are. We're going to get into a community panel. We have 2 guest speakers with us today. And then we're going to go into community-led action and communication plans. That will be an activity where we're engaged with you guys, talk about the 4 stages of the recovery process, and then go into the action plan template as well. Okay, next slide. So some of the learning objectives that we have today are, 1, to describe the role of the UNC Regional Emerging Special Pathogen Treatment Center, or the RESPECT sites, and emergency preparedness for emerging pathogens. And then 2 is to elicit community leadership voices in developing action plans before and during pathogen responses. Okay. Next slide. Dr. David Wall said outbreaks begin and end in the community. As we know, the ongoing COVID-19 pandemic has significantly and negatively impacted historically marginalized communities, specifically African Americans, in terms of lack of access to life-saving healthcare services like testing, treatments, and vaccines. Okay, next slide. So I want to pose this to the group. How can we best engage and maintain trust with communities before outbreaks occur? A lot of this lack of access can be connected to historical mistrust that marginalized communities have toward institutions and researchers in general. So ask for your expertise. Again, how can we best engage and maintain trust with communities before outbreaks occur? You can put your answers into the chat. How can we best engage and maintain trust with communities before outbreaks occur? Cherie said consistency. Yes. Can you explain a little bit more about that, Cherise?
Yeah, for sure. Like when we go work with our communities, with the communities, we don't go in there just because like we have a grant or we have an agenda to push. You know, we're there even when we're not being funded to do so. That kind of.
Right. I agree. Shamika said correct information. A lot of communities, there was a lot of misinformation or disinformation that that surrounded communities regarding testing, vaccines, COVID-19 in general. So just having correct information to share with partners, community members, and individuals. Yvanka said, build trust, be there in the moments that matter the most. Yes. Sharon said, maintain open communication in a simple and plain language, also in appropriate language. Yeah, so going back to also the misinformation, disinformation, making sure that communities can understand and it's culturally competent and relevant to who they are, so they can better assess what they need to do, who to contact, and where to access information. Thank you. And so thank you for, and you have other responses, please put it in the chat as well. Now I'm going to pass it to the UNC team to talk more about the respect sites.
Great. Thanks, Keisha. Can you hear me okay?
Yes.
Wonderful. Thank you so much for having me again. And I keep processing everything that we learned and discussed from our first session. So my name is Billy Fisher. I'm a critical care physician. So I take care of patients in the intensive care unit at the University of North Carolina. But I also specialize in, unfortunately, I specialize in severe viral infections, and that includes viruses such as Ebola virus and Lassa virus and the virus that causes COVID-19 or SARS-CoV-2. And over the past 10 years, I've been sent into outbreaks of some of the scariest, I would argue, viruses in the world, including outbreaks of all of the major Ebola virus outbreaks over the past 10 years. And I'm trained as a doctor. And I'm trained as a scientist to think about the virus. And what I've learned really over the past 10 years is that the community is just as important, if not more important, than the virus that you're treating. And so that's part of the reason that I'm here today. If we've learned anything over the past 20 years, it's that emerging infectious diseases are going to be with us for quite some time, and they're going to cause a lot of problems. This is a nice diagram of viruses that have emerged over the past 20 years, beginning with the severe acute respiratory syndrome, or SARS virus in 2003. We've seen avian influenza in 2004, and more recently, we've seen avian influenza circulating among animal populations in the past couple of years. But we've also seen new and old viruses emerging. So for Ebola virus disease, we've seen increasing size and frequency of outbreaks that have really threatened global public health. And the days of an outbreak occurring in a remote portion or remote part of the world and being localized to that part of the world those are over. And we are connected really with every community by a plane ride under 24 hours. And so so we really are increasingly a globally connected community. And so an outbreak anywhere is really a threat to lives everywhere. And so in response to this, next slide, please. Just realized that I couldn't advance them. In response to, I think, the increasing threat of emerging infectious diseases, the Administration for Strategic Preparedness and Response, or ASPR, really has increased the national capacity to be able to both care for patients with a special pathogen, such as like Ebola virus disease or Lassa virus, but also to kind of coordinate an outbreak response. And so these 13 centers are located across the United States, and at least one center is in each of the regions that are identified by a different shade of color and a different number. And so UNC and Emory are two regional emerging special pathogen treatment centers, or RESPTCs, in that southeastern region. And we really have our task is really a couple of fold. Number one, it's really to serve as leading providers of care to improve our ability to respond to outbreaks of emerging special pathogens. And specifically within that broad umbrella of preparedness is an enhanced ability to care for patients with highly infectious diseases. And so UNC has a center, and we've been training and we've designed this location to be able to safely care for that patient and provide that patient with the full complement of care, as does Emory. So in addition to care, it also we also have the role of coordinating. So in an outbreak setting, how do we work together to improve our ability to respond? And then number three, it's really all about collaboration. How do we train other healthcare facilities to be able to handle a patient with a special pathogen? So building that preparedness regionally. And lastly, it's also building an emerging special pathogen research capacity so that as we provide care, we can learn about what is needed to provide the best quality of care for that individual, and what's needed to stop the outbreak. Next slide, please. So as I mentioned, over the past 10 years, I've responded to almost 8 outbreaks of Ebola virus disease in a number of different locations. And as I was mentioning, I'm trained as a doctor, and I'm trained to think about the virus, and I'm trained to think about the therapeutics that we use and the care that's required. But what I've found is that even with the fancy innovations like new vaccines and new treatments, the outbreaks don't end until we engage with the community. And so that's really where this idea that outbreaks begin and end in the community. And so for me, it's been a really important learning experience about how do we engage with communities before that outbreak happens. Because all too often we show up only when there's a medical emergency. And so there's no doubt that there's a significant lack of trust that exists. And so we're trying to think about, well, how do we do this better? How do we engage with communities, particularly because in all of the outbreaks that I showed you before, the distribution of resources, including information, including diagnostics, therapeutics, and vaccines, have not been distributed equally across our population. And so we are trying to reimagine how do we respond better to ensure equal access to care, to equal access to information, diagnostics, therapeutics, and vaccinations. And so this is a large part of engaging and trying to understand how do we do better, leveraging lessons from the past. So thank you again for having me, and happy to be with you all.
Thank you so much. And next, we're going to go into our community speakers. So I'm just going to first introduce Belinda Jones-Hill, who is an active member of the Roanoke Valley Breast Cancer Coalition, where she's a project coordinator. And over the last 3 years, she has worked tirelessly with the CDC Foundation and the Gregory B. Davis Foundation on educating the community about COVID and the importance of the COVID and flu vaccines. Next, we have Yesenia Cuello. She is a former farm worker, the co-founder of NC Field, and is the current executive director. NC Field bridges the gap between agricultural workforce and rural Eastern North Carolina and vital health and human services. So I'm going to pass it to them so they can introduce who they are more in depth and their organization and what they do to address different health and social needs. Oh, you're on mute, Belinda.
Okay, sorry about that. My name is Belinda Jones Hill. I am actually a retired nurse of 33 years from the former Halifax Regional Medical Center. I was the intensive care unit nurse manager. And I was working with the Roanoke Valley Breast Cancer Coalition, actually doing breast cancer work. And at the time, we had a grant from the Coleman Foundation linking citizens in our community. When I say community, I'm talking about Halifax, Warren, and Northampton counties in eastern North Carolina to services like paying for and getting them sent to the tertiary centers for healthcare and making sure that they could meet those needs when they were fighting the fight against breast cancer. And along came COVID, and everything changed on a dime. And because of our extensive work in the community, working with several different agencies, we decided to apply for a grant for CDC. Had no idea it would be a 3-year journey. And in that process, if you all would recall, when COVID first appeared on the scene, information was changing daily. It was hard to keep up. It was hard to keep the community abreast to things that was going on. And so and there was no place that people gathered other than the grocery stores. And so then we started having pop-up food banks and pop-up this. So we just met the people where they were. We did engage with our university partners from UNC and from North Carolina Central University, got great information from CDC and other organizations. And so we just made flyers and sent out information about as the most current information we had on COVID. And then when the vaccine became available, we did one of the things that I think we were most successful at was engaging our local health departments. We set up a we call it health directors collaborative, and we invited all of our health departments in to say, look, we are here. We want to be a community resource for you. How can we help you get out the message? And what we found was a very I don't want to say it was different in every county. People were calling. We had vaccines at this time, and I'm moving forward, and they were calling people on their phone lists when so they wanted to discard vaccines and was just trying to get it. So our goal was then to let's organize vaccine sites around our community so everybody would have equal access. But that was very pivotal for us that we wasn't not stepping on the health department's toe, but we were working in a collaborative effort with them. And so then as time went on, we started going out to different communities because in our community, the elderly people who was designed for people, they were getting their vaccine. It was our young adults who was not being vaccinated. And we ended up doing a rap song. We did a whole lot of outreach in that community. And what we found was that the communities that was accustomed to the Roanoke Valley Breast Cancer Coalition, whether they were our trusted messengers with our churches or lay health advisors, they came up with all types of creative ways of reaching people and as well as contacting with people who were lonely by doing things like porching and making contact. But there were some communities that we just could not break through. And one of those in our community was the Hispanic community. And we realized it was because the things that you're talking about today, we had not established a relationship in that community beforehand. We did not have a contact. And until you establish relationships in communities, I think we will continue to have this, not just in the Hispanic community, because our population that we were reaching out to was the Black community. And when you hear so much information, I mean, because by this time, disinformation was probably as prevalent as real information. And so that was actually a conversation that we had to have that, you know, that this is the information that we have. We don't know anything about impotence. We don't know anything about all these other stuff. I just want to share with you the information that we have. And I learned to be very respectful of everybody's opinion, whether they were going to get the shot, was not ever going to get the shot, that they all had a very valid reason. And so our goal became simple. Let me give you factual information. And we got our factual information from the CDC and our university partners and all of that. So in the end, we did go on to publish. I wanted to have a written document, and so people can so that the community partners could see the work that they did in this. We published a magazine, and some of the things that we thought was a resource guide. So that's my spiel, I guess.
I can take it right after you, Ms. Belinda. So I thought that was absolutely amazing. And I love hearing that other people and other organizations that also incorporated some of our learned lessons. So my name is Yesenia Cuello. Thank you so much for having me here today. I want to say that I come, exactly as we mentioned on the introduction. I'm a former child tobacco worker. English is not my first language. I grew up with an undocumented experience, and, it's extremely important to incorporate, the fact that, if you don't have that trusted community members, or if you haven't taken time to build those relationships, foster those relationships, then it's really hard to kind of break through into some of those communities, especially because we're talking about historically marginalized populations. And to be honest, that's exactly what we saw during the pandemic. I want to say that one of the things that definitely came out of the pandemic is the fact that, farm workers are now essential workers. And we know that farm workers have been harvesting our fruits and vegetables for years, but it took a pandemic for, the rest of the world to catch up to us and realize that, hey, farm workers are essential. And they've been doing this work since before the pandemic started. But at the same time, there was also a lot of misconceptions. And, what was causing this shift is we were so used to being ignored for so many years that now whenever we became the target and the focus of COVID-19 response activities, it was there was, how will I state it? There was this sense of, people were skeptical. It's why now? Why us? Types of questions. So definitely extremely important to meet people where they're at. The work that NCField does utilizes a social determinants lens to help not only streamline, but deliver some of those direct resources. So identifying what were some of those gaps. We definitely want to be very aware and very transparent in our own capacity and what are the limits of our capacity. So what are some of those gaps that were keeping people from being able to access some of those services? And identifying that, like we said, outreach is extremely important. What is your target population and what are some of the challenges and barriers that they're facing? And how do we shift that top bottom approach that we're so used to seeing? Because in the day, the people that know how to solve those problems are the community itself, and realizing that they are the experts was extremely important. So it's we can be community focused all day long, but what can we do to be truly community led and work alongside communities to help overcome some of those challenges and barriers, especially the ones that we saw as it came to access. And it wasn't only for COVID. So it's all services.
Wow, great. Thank you guys so much for introducing yourselves. I know you touched on it a little bit, but I want to get into the first question as what's one or two most important things you did to help address COVID-19 in your community? And either one of you guys can take it first.
Okay. I think the first thing that we did, we used we call it the POW approach, partner, inform, and empower. And so we use our established partnerships to just reach out in all the communities in all 3 counties. We got accurate information using all of our resources, whether it was the CDC or the NC-SEAL and the students working with us. And we did a whole lot of just canvassing, pop-up events, meeting people where they were, because, there was no such thing as church. And everybody was saying, well, engage the faith-based community. And we learned we had to be very careful engage in the faith-based community, because with this particular event, it became very political. And so some people will say, oh, I'm not going to take that shot because this is what God has ordained for us. And it was so, you just can't say, well, get our trusted leaders and faith-based. So what we did was we went for what we knew, and that was our trusted messengers that we'd had all along, and the people that we grew up within the community. And we just grew the community.
Nice.
Yeah, I think for us, one of the things that we saw was we oftentimes got the response of, farm workers in the Latinx population, they don't want the vaccine. They historically have never gotten the vaccine. But once you go out and do outreach and kind of hear like the reasons for why, we realized that the core issue is the fact that it wasn't an access issue. And I definitely, and I'm trying to read the chat and also engage in conversation, but yeah, definitely community health workers and, some of those established people. But I wanted to say that one of the lessons learned was like, whenever we looked at the resources and what were some of those challenges that our community was facing is, day, time, and location. Like, what days are you available? What times are you open? Are you open only during those traditional hours of 8 to 5 or 8 to 3? Because and are you located in a place where the people even feel comfortable approaching you to access the resources that you're trying to provide? And, realizing that maybe unintentionally, the way that things have been done historically has been excluding the working poor population. Or maybe you're located in the city. And whenever you look at rural, like the issues or the solutions for rural versus urban look completely different.
Yes.
So I like that whole one size doesn't fit all, because to be honest, it was exactly that. And it was like, what does outreach look like for you and what needs to happen? Because don't get me wrong, like I feel like everybody incorporates and identifies or defines outreach in very different ways. And yeah, maybe it does look like, leveraging social media. Maybe it does look like making phone calls to some of your patients. But for us, we had to look at our most vulnerable person, and we had to like definitely incorporate like the social determinants of health or the social drivers of health. Like, what does that person need to make sure that we're addressing the access issue? And to be honest, some of those were like, it was language, it was cultural competency, it was transportation, like you name it. I mean, when it was digital literacy, whenever we came about wanting to address the issue of people not being able to access accurate health information, like it wasn't as simple as handing somebody, a hotspot and handing somebody a computer. Like maybe that person doesn't know how to use that computer, or maybe you've equipped somebody with a computer and a hotspot and they're going to Facebook to find accurate health information. Like how do we create a holistic, broader approach to how we address access to health information? Like, are we teaching people how to source out accurate health information so that we're not causing a problem while trying to solve another?
Did you find that how it was set up was for the rural community, was a barrier within itself, asking people to do everything online? And I'm gonna speak for my communities. We don't have internet all through the community, and even when the schools closed, they were busting out internet buses so people could do their work. So, yet we still use that model to ask people to, oh, this is how you sign up, and this is how you do that. And when our literacy competency is not that high to begin with. And so I thought how it was structured, it was more structured for more urban communities and not necessarily rural communities, but that was the model that everybody used.
I think one of the things that came apparent was the fact that the people that structured that model had their experience, and the impacted community in rural areas were not a part of that conversation. Otherwise, that wouldn't have been a challenge. But yes, whenever it comes to rural communities, we definitely have those spots where you have absolutely no internet. And, whenever we talk to people about health and they're like, oh, Yesenia, telehealth would just solve every problem in the world. Now you don't have to worry about finding daycare. Now you don't have to worry about transportation. And I'm like, yeah, but whenever you look at access to rural broadband, yeah, I'm really sorry, but that doesn't necessarily solve the issue to accessing healthcare services.
Yeah, exactly. I think really asking yourself, like, who has a seat at the table, and making sure that all voices are being heard. And so it's not just okay, someone in the urban environment, okay, this is my experience, like you said, and this is some of the issues that we're experiencing. But when you look at someone else from a complete different environment, it's like, no, these are actually our issues, and this is what we need to do to address them. And talking about the social determinants of health, language equity, those were some of the main things that were issues during the pandemic and are still issues now, where we focus on one issue, but we can't create sustainability, change, upward mobility if we're not addressing these other aspects that affect their life. So it's very important to see who sits at the table and really addressing various drivers of health to see, okay, how can we adequately and effectively address these needs? So I definitely agree.
And
yeah,
I think,
oh, I'm sorry. Go ahead, Miss Belinda. You're fine.
I think that when we talk about that, if we don't address those issues, I think you said it earlier. You all of a sudden we're saying, help, help, help. We're here to help you. We're here to give you information. We want you to access this health services. But yet I cannot go. I don't have a physician, so I can't just, unless I go to urgent care someplace. I don't have access to dental care. I don't have access to regular I don't know, any other care, but all of a sudden you want me to do this, something must be wrong. So there's an automatic red flag that flies when you just focus on that one thing. Well, and I guess care is really holistic in that sense. So if you don't act like you care about my childcare needs, my dental needs, whether or not I live in a food desert, then how do I believe you care about me to take an injection or something else? Because that was a major issue in the Black community.
Yeah, exactly. And even what Sharon said, having someone that looks like you, whether you're in a healthcare setting, that racial concordance, like having someone you trust who's going to give you accurate information that's outside of whatever the news or media is saying, someone that you trust, that can go a long way within communities.
And I think one of the things on the back end that probably didn't happen is ensuring that they were at the table. And you know, it's not something as simple as just making sure that they're at the table, but making sure that we've done the back end work and the professional development, making sure that we've equipped people and community members with the tools they need to truly engage in those conversations. And I think that's important. It's not about, you know, giving somebody a seat and just space at the table, but you know, there's work that needs to be done prior. And I feel like the pandemic definitely highlighted that's work that hasn't happened historically, but that needs to happen.
Exactly. Okay. In what ways did you try to gather accurate information, reduce the spread of COVID-19, and provide truthful information to other organizations, partners, and community members? I know we touched on this a little bit. I want to go a little bit more in depth on different strategies you guys use to retain this information.
I guess I'll go first. One of the things that we did, we already had a network of people that we worked with. What we found is that network was not wide enough to get in the people that we wanted, because we were also looking at the statistics, and our statistics stayed pretty flat. And it has remained flat in our community. So we said, okay, how else can we reach out? So then we went out to other organizations who had similar missions, like some of the fraternities, sororities, community-based groups that was, oh yeah. And so what we did, we educated them similar, and we gave them the information, so it made it easier for them to join with us. And they put out, they had vaccine events, and they put out a lot of education, and they did a lot of outreach. And what we realized during that time, because one of our goals was to reach out to the indigenous population and the Hispanic population, because we did not have a firm standing in especially the Hispanic population. We just failed there. And it was because we had not done the groundwork first. And the groundwork is very, very important in building that trust, knowing who we are, and equipping their leaders to do what we wanted everybody else to do. And so, okay. And so, so that was important. That was important for us. But we use our same tools that we started with, and just gave it. I think we ended up working with about 10 organizations, and it really made a difference in the amount of people we touched.
Mm. Yes.
Yeah, I 100% agree. So we are highly transparent, highly supplemental, highly collaborative in nature. So it's like, how do we bring people to the table, especially, for example, if we're regionally and we're trying to all serve the same population within this area, like what can we do to make sure that we are not duplicating services, but rather expanding reach and access. So I want to say that that was extremely important. Whenever it came to the pandemic, one of the things that we thought was super important is realizing that, you know, the pandemic didn't discriminate. So making sure that people's efforts or strategies were reaching the people that they needed to, which was everyone. So that was honestly, that was a really good thing. It was like, this is where we could all come behind something together because it was impacting absolutely all of us.
Right.
I want to say that you know, some of our partners that we also had was making sure that we asked, like we had a partner that came out of the pandemic, and that was Walmart, you know, and they were some of those people that would have volunteer pharmacists that would come out with us to help with doing like COVID testing or providing any sort of vaccine. But I remember that back in the day, whenever we were doing the PCR COVID tests, we were struggling with being able to provide COVID testing during the days and times that the community needed us to be available in order for them to be able to access a COVID test. And I want to say that making sure that they weren't asking a question or asking for unnecessary information. So for example, if you're doing COVID testing and you're asking people to show you a copy of their driver's license, which is unnecessary information, that may be a barrier for why somebody doesn't go and get a COVID test.
Exactly.
So being open to calling out some of those efforts. So like, don't ask for unnecessary information, only ask for what you need. But we ended up having to partner. A lot of our partners actually came from outside of the state of North Carolina. And to be honest, that was very shocking for me. It was like, we need COVID testing in rural Eastern North Carolina, and yet my partner wants to remain anonymous, and they're in the state of New Jersey, you know, and that was just what we needed to do in order to be able to do that. We needed to send over our COVID test and then, you know, get the results and make sure that people got that information so that they could isolate. But then whenever you look at things from like a vulnerability index, so whenever we look at the social determinants index, it's like, now you've told somebody that they have COVID. Now they have to isolate, but maybe they're not able to isolate. So how are we, you know, looping, like, how am I telling, like, even whenever it comes to preliminary screening for anything, like we're looking at diabetes, we're looking at hypertension, and it's like, okay, now I've told you that, you know, you have this, and yet I'm not offering you a solution or a route or a way around to addressing that in a holistic way that is relevant and culturally competent to what you need. So I think that was extremely important.
Yes, thank you. And touching on social determinants of health and drivers of health, how did you center equity in your work as you're engaging and communicating with communities?
Our organization was centered on equity because we started because in the three counties, Halifax, Warren, and Northampton County, we are the majority minority, and our outcomes for breast cancer mortality was higher than the minority population. So when we started this organization, it was to establish a pink print so that women in this community would get mammograms earlier and seek health care sooner to reduce the mortality rate. So our organization started on that. And so I think that's another reason that we were chosen, because that was where we started from. That was our background.
Yeah, I want to say that for us, equity was at the heart of everything that we were doing. I know that I've referenced like all the social determinants of health assessment or the vulnerability index, how we refer to it out here. And it was like, for example, it's not only helping you get a COVID test, but what are some of those other social determinant supports that you also need? And how am I connecting you to those needed and essential services at the end of the day? I want to say that one of the other things that we did around centering equity is like, how do we measure impact? Because yes, even though it's extremely important to hand out flyers and to give this information out into community, it's like, how many of those flyers did you hand out actually result in a vaccine? So it's like shifting how we measure the impact that we're having in communities. So for example, if I print out 1,000 flyers and nobody shows up to an event, then am I measuring it by the number of flyers that I printed out, or am I measuring by the number of people that now have a vaccine due to our efforts? I was like,
Right.
so I think that is how we centered equity in our work.
Yeah.
We did something similar to that. Is we even put an op-ed in the paper looking at the data from North Carolina Health and Human Services, and that's how we know we remain flat. And that was our compass in doing this work.
Mm-hmm.
And we published it. We just published it in the paper, and people started to talk about it because I know the 3 counties are very close together. But when we started, Northampton County had a 40% vaccine rate.
Mm-hmm.
And that was when we were told to take off the mask.
Yeah,
wow.
we reached out for receiving a lot of the feedback, and I feel like we've referenced it on this call with people saying, oh, this community doesn't traditionally get vaccinated, but yet whenever people were talking about the vaccine, so it hadn't even come out yet, they were like, we're going to go out there and we're going to vaccinate the community. And I kid you not, they painted this beautiful picture. And as much as I wanted to believe that, I knew that that is not how it works. If you hadn't taken the time to build that trust and implement outreach and engage in community, I'm like, it is not going to look as pretty as you had hoped. I was like, and yet there were these shock cases whenever people would hold events and nobody would come. And it's like, outreach is extremely important. Community engagement is extremely important. If you haven't built that trust with community and they don't feel comfortable, or you're doing it during a day and time whenever they're working, I was like, if they have to decide, sorry, there's a train coming by next to me, but if they have to decide whether or not they're going to go to work to make money to put food on the table, or to go to this vaccine event, I was like, I'm going to let us all run into the assumption of what decision was made. And that's the fact that, they went to work, because whenever we look at even like the nature of agriculture, I'm like, there are so many things that don't exist. Like there's no workers' comp, there is no job security. If you miss one day, you are easily replaceable. And to be honest, I don't even want to go down the rabbit hole of what that looks like. Even whenever we're talking about child labor, it's like we realize that yes, like a child as young as the age of 12 years old can work in a tobacco field in the state of North Carolina, but yet we want to make it 21 in order for them to go and purchase tobacco. But I'm not going to go down the rabbit hole of that one, because that's very for me.
Mm-hmm. Yeah. Okay, thank you. We have time for one more question. Given some lessons learned that was talked about earlier in the session, how can you use those to prepare for the next pandemic or the next emergency that occurs?
I think what you're doing right now is getting ready for that is pivotal for the next time. I think you have to establish those networks. You have to be in communities all the time. You cannot just wait till something to pop up and then you say, oh, well, we got to do this, we got to do that, because people distrust that behavior. One of the things I think that I learned at the from this last event was, somehow, I don't know how, I know the nation is polarized. We have to say information will change so people don't get confused about what's going on. And we have, I guess transparency is the key word. And we have to recognize what is truth, because misinformation took over. And so even people who thought about getting the vaccine and wanted to get the vaccine was so unsure that they were paralyzed about getting vaccinated. So as we move forward, I think that one of the things that the Roanoke Valley Breast Cancer have are trusted messengers all the time, because that's how we get out the work. But
Mhm.
I think that we need a more organized body of people that includes academia, research, local healthcare facilities, because local healthcare facilities, I know they should be like the gatekeepers and all, but they keep the gate closed a lot because they present so many barriers to access to care, whether it's identification, whether it's ability to pay, some rules that you've never heard of before. So we have to address all of those things and make healthcare, period, accessible to most people, instead of excluding healthcare. And not only healthcare, good quality healthcare. Just
Mhm.
because I live in rural Eastern North Carolina doesn't mean that I should have substandard care. I should get the same care, or the same standard of care that you would get in Raleigh, Durham, Chapel Hill as you have here. And that doesn't happen. And I know that may be high and mighty, but I believe if you talk about what you want, you at least work that way towards getting it. So I think we have a lot of issues to work through, from the community base to the barriers that is presented, that prevent people from getting what they need when it's not a crisis. And so when it's a crisis, all of that is exacerbated.
Mm. I agree.
Yeah, I thank you so much for that, Ms. Belinda. I definitely want to tie in that I think people should realize that there are going to be struggles whenever you are not familiar with the culture of historically marginalized populations and addressing some of those needs. And I just honestly, I absolutely love also what I'm reading in the chat, because it's good to know that it's honestly exactly what we did. If, for example, if we heard, if somebody got COVID and we realized they needed to isolate and they were probably not going to isolate because they need to go to work, there were direct assistance funds that got handed out throughout the pandemic. I want to say that NC Field as an organization, due to funds that we've received from others, were able to hand out over $200,000 in the form of direct assistance so that people were able to isolate. A lot of that funding also went towards, for example, why should you have to decide to use the last bit of money that you have to put gas in your car to drive to a grocery store, or make the decision to do that, or go to a COVID-19, testing event or testing site. So adjusting that one, for example, we know food, and the fact that a lot of us live in food deserts. If you've been working all day and you're going to go home to your families, food is a huge issue. So we made sure that if people were coming to us for an event or whatever it is that we were doing, you not only walked away with a vaccine, but you also walked away with a hot plate of food. Another thing that we did is making sure that, we were strategically and intentionally from within communities, because they are your experts, they are your trusted entities. So making sure that we hire from within communities, we equip them with professional development training. A lot of them have been state certified through their community health worker state certification, to make sure that even though COVID-19 funds were not sustainable, so we were like very much in that scarcity mindset, like, we funding you for the next 3 months, but there was no guarantee. We wanted to make sure that due to what they were earning, like the state certification and other professional development training, they were going to be able to take what they've learned and maybe implement in another organization. So always following the mission of leaving people better than you found them, and making sure that that was a large part of what we were doing as well. But definitely, I also see is making sure that, organizations were funded to do this work. And we saw a lot of that. And I'll be 100% honest, there have been times whenever funding has rolled out and I have yet said yes to funding, that, to be honest, we needed a whole lot more in order to implement. So it's like, whenever we look at that trickle down effect and the lack of transparency, like, yeah, maybe, there was $1 million that went towards supporting this initiative, but by the time it makes it to the organizations or the community-based organizations or community health workers that are doing this work, like, we want to give you $7,000 to actually implement the hard part of this project.
Right.
Yes.
Mhm.
Like,
Yes.
so we saw a lot of that, and there's such a huge lack of
Yes.
transparency. But to be honest, like that is currently where we're at. Like community-based organizations were definitely essential to addressing the pandemic and to ensuring that we're alive to be able to tell this story. But like, how are we going to continue to make sure that they're supportive? Because now that we've created something or are providing this service, you know, after the pandemic, it's still needed. So are we equipping organizations with sustainable funding to continue to make this happen? Whenever we look at health services, I definitely made it my priority to ask, because I realized that, you know, if I don't ask the question, the answer will always be no. But giving
Yes.
people an opportunity to turn me down if that was the case. But at least I made that ask. And through that, we now have a partnership with the free clinic out of Campbell University. So we partner closely with Campbell Community Care Clinic, which is a free clinic from Campbell University. And we, on a weekly basis, provide clinical services that actually don't start running until after that 6:30 p.m. time until almost midnight, because we realize that that's what the community needed in order to, you know, access and address health concerns. But yeah, I mean, it's a lot of work and it's not easy, and it's, you know, we're extremely essential. And I hope that people came to the realization after this.
Yeah. So, yeah. Well, thank you guys for participating and sharing wonderful insights. And thank you everyone in the chat who contributed to the engagement process. Now we're going to move on to an activity for further engagement, and hope that we can just come up with some hard, tangible outcomes that we can walk away from this evening. So next is the community-led action and communications plan. So an action plan is basically a document that lists what steps must be taken to achieve a specific goal. The purpose of an action plan is to clarify what resources are required to reach the goal and formulate a timeline for when specific tasks need to be completed. So it's really highlighting that mission, vision, and goals aspect. So although there is much knowledge on the detection of pathogens in response to the occurrence of emergent pathogens, more public health workers are needed in the field to control the spread, the care for patients, and implement timely public health responsiveness, as we touched on earlier. Emerging pathogens hit the hardest in communities of color due to structural racism and other determinants of health and drivers of health that often are ignored and neglected. To adequately address these factors, we must consider communities' role and impact it has on the spread of emerging pathogens. So really highlighting community-based organizations, health agencies, non-traditional organizations as well. So an action plan needs to be implemented to address the steps when faced with a new pathogen, and ways that we can translate it back to the community through language equity, through racial concordance, through social media, through news outlets, etc. They need to include CBOs, faith-based organizations, grassroots organizations, non-traditional organizations, and sometimes academic institutions as well. And so next slide, please. And so we're going to get into the emergency response cycle. There are 4 components to an emergency response cycle: mitigation, preparing, responding, recovering. Then at the center of all that is community partnerships. To be done well, it needs to be rooted in strong partnerships between communities, institutions, government officials to address the emergency. Next slide. So the core is community partnerships, which are crucial for controlling disease outbreak and mitigating disasters. The COVID-19 pandemic has reconfirmed the need to elevate community engagement partnerships to build equity, trust, and sustain action in future health promotion preparedness strategies. This will be used to strengthen community action and the opportunity for better outcomes. Also, community-centered approaches focus on objectives such as building communities' capacity to address social determinants of health, facilitating multi-sectoral collaboration, deepening access to community resources and information, and facilitating opportunities for civic participation as a means for promoting health. So some ways successful partnerships are relationship-centered and not transactional. So ask yourself, what is the common interest or issue that brings us together? There should be a win-win when partnering with communities, and acknowledging power dynamics. So especially if you're a researcher coming in, recognize that the community are the experts. You're going in to listen and learn. and to grow with the community, not tell them what to do, have them identify their specific needs. And there's nothing about us without us. So again, as we highlighted within the community speakers, CBOs are that core foundation of partnerships, accurate information, transparency, language equity, and lastly, transparency builds trust. And so these are all ways that we can center community partnerships in our work, whether we're just engaging with communities on health and social needs or when involving emergency preparedness. You can go to the next slide. So mitigation, it measures that prevent an emergency, reduce the chance of an emergency happening, or reduce the damaging effects of unavoidable emergencies. So it is a worldwide collaboration to prevent the emergence of novel pathogens through preparation and planning, and also to recognize the emergence of a pandemic and how it unfolds. The only defense is to monitor and identify the pathogens sufficiently early and pre-establish mechanisms, practices, and tools to stop it from spreading and potentially extinguishing it. Once it spreads, community must gear up in response to the capabilities, but we need support. Communities need support, whether it's from funding agencies, other organizations, other communities, recognizing that more resources are given to urban communities rather than rural communities. So really sharing those resources and recognizing that each community needs a tailorized approach in responding to emerging pathogens. Emerging pathogens mitigate planning reduces loss of life by minimizing the impact of pathogens, emergencies, and disasters. So these emergencies begin with the state, the tribal, and local governments identifying potential emerging pathogens and other risks and viruses that are common in marginalized communities. Identifying these risks is vital when engaging communities as well. And also mitigation plans are key to breaking the cycle of damaging effects of emerging pathogens. So when you think about Hurricane Katrina, there wasn't a lot of planning in the process of trying to mitigate the destruction that it caused. And so that left, still to this day, New Orleans still suffering from the remains of Hurricane Katrina. So it's vital to incorporate the community when thinking about how to reduce the risk and harm of a pathogen or an emergency. And some examples of activities can include a community action plan, community engagement, accurate and transparent information, and then recognition of historical legacies as well. And now I'll pass it to Alan to do the chat storm. You can go to the next slide.
All right. So we have, first of all, I just want to thank Brenda and Yesenia for your stories. And this is just so awesome. Brenda, I just especially, you really nailed it when you said, the crisis exacerbated some of the problems we have in these communities. But what about when there's not a crisis? Like how do, so I think that's what we're all about today. It was great to hear from the Respect Centers. And, kind of these are federal resources that are in our region. And the community activists, like the small group that's with us today, are the connectors, right? How do we do this? So given it's a chat storm, just shout it out. There's not many people here. Come off mic, come off mute, whatever y'all want to do. But given what you've heard today and your own experiences in your organization, what are some of the key activities that need to take place for mitigation to ensure that we're prepared? Just shout it out, talk to each other, because Belinda and Yesenia have really, started the conversation. You are connectors. We need to collaborate. The United States does not have a federal system where everyone has access to insurance without barriers. And the crisis did exacerbate this. So moving forward, connecting with these resources, what are the steps that we can take? So I have here, Ivanka, have money to reach the communities in many ways, and you did billboards. Ms. Hall, would you be willing to come off mute and just talk a little bit about some of these mitigation strategies? I see you chatting with us on.
As you can see, I'm passionate about the work.
Yes, ma'am.
I thank the ladies that were speaking. I think that the work that they were doing is, I'm gonna turn this off so it won't shut me down. I think the work that they're doing is instrumental to our success. But one of the things that I saw, and I when I talk to people across the country, because I'm on a number of research projects around COVID, and I work with a number of other things, like we do all disparities that impact the African American community, is that the CBOs were asked to do a mountain of work without fully being funded. For our organizations and for many others, we did the work because people were dying. Like I lost 65 friends to COVID. 65. Like they were gone. They ain't coming back. The realization was COVID was taking people out in our communities, and there was nothing. Like when our government shut down, our local, state, city, county governments did the same thing. They shut down like there was nothing else going on. Like, hey, figure it out yourselves. And so what we did was what CBOs and these ground organizations have done all along. We said, yeah, we don't need you to figure it out. We know what the problem is, and we're going to go and help make the solutions. And so for us, before we had the vaccination available, we knew that a lot of disabled children were not going to be able to get to the food sources. So we created a food program, in one day, got a food program. We sent out 250,000 meals from my house, not from an office, not from a building, not from an agency, out of my house. Hundreds of volunteers came here to pack lunches for children that were disabled, because we knew that a lot of our disabled children are being raised by seniors. And if something happened to their grandparents or their aunts and uncles that are older, then where would those children go? And what we see as the end result is that African American children were 2.5 times more likely to lose both of their parents or caregivers to COVID. We don't even talk about that. We don't talk about the fact that all these children are in these systems now because they have nowhere to go. They have absolutely no family because they lost everybody. So we have to fund our CBOs. We have to make sure that what happened during COVID, where the money came and hardly any money actually went to the boots on the ground. I'm telling you, I spent the first $10,000 that I used to buy food for my 125 families that we were serving. Some of them had 10 children. $10,000 on my personal credit card. On my credit card, not somebody else's credit card. Like for me, I was all in it because you know what? My mother was murdered in front of myself and my younger brothers when I was 6 years old. So I looked at these children as me. What will happen if we don't do everything in our power to make sure that they get what they need? And so for us, making sure that these CBOs are funded, that whole around foundations, giving people $1,000 is going to do nothing. Especially if I'm saying we spent $10,000 to send out food. That was even before the vaccination clinics. But vaccination clinics, we made sure that people had hot meals. Also, with no funding, we made sure that they had hot meals. We gave everybody a bottle of water, because one of the things about taking a vaccination is if you are hydrated, it helps you to not have the side effects. And so what we made sure of is that people got water. You know what? When the hospital saw us giving out water, they started doing it too, because I explained to them why. We're doing this because people are going to have side effects if they're not hydrated. And we were getting too many people who were coming in because they weren't hydrated. So it's like, let's make sure that they got the things they needed. And so that's just my take on it. We just have to treat the community like they're ours. And that's what CBOs did. And that's not what we saw from foundations. Foundations said we're treating these communities like they're ours, but that means you're treating them like you always treated them, which it sucks because the money did not flow to these organizations. These organizations that were doing the work had did a yeoman's task before they even got $5,000. And many of them are still doing the task because COVID, believe it or not, still here. So we still sending out care packages to families that are impacted by COVID. I had a whole family last week, all of them at the house because they all tested positive for COVID. So yeah, that's my take, is that we really need to do something about the ambiguity of the funding around foundations. Foundations got all of this money, but the community didn't see the money. And the people that we looked at as trusted sources aren't always who the community trusts. Just because you trust your minister doesn't mean the community trusts your minister. And so I think that we have to understand that too. Every Black person don't go to church. So we can't make all of our responses about the Black church because everybody's not going there.
Mhm.
Thank you, Ms. Hall. Yeah, that is absolutely true. So when I'm hearing this in mitigation, is that you need to look at direct services,
Mhm.
and you need to look at end users. And I think one good thing that you're saying, Ms. Hall, is that we need to rise up these stories, these narratives about COVID in the field, on the ground, to help people better understand these channels, right? That's an important story for mitigation. It's like telling your story about direct services, and that's extremely, extremely important.
And I will add.
Oh, if you type in my
yeah.
name, you'll see my story everywhere because I was so pissed that all the news channels started to talk to me because it's like, what the heck is going on here? Why are we not? We got 100 cars lined up to come into this lady's driveway to drive food to families. Like, I didn't know these people. These people had never met me in their life, but they saw me at community events, saw me speaking, and they were willing to come to my house, help me load up food, and then go drive food to families and communities that they never have ever been into. Like, for me, that meant everything. We did the billboards, we hosted support groups, because if people are dying and they can't memorialize their loved ones, then obviously there's a mental health factor going on. If you can't give grandma a funeral, and all these people are like, we can't memorialize our grandmothers, our aunts, our uncles, our cousins, then just think about what happened to these folks mentally. And then the food apartheid, that whole thing about addressing the shortages that were already there. Because if you don't have money, you don't have a job. Remember how many people lost their jobs? If you don't have money, you don't have a job. How are you supposed to feed yourself? How are you supposed to feed your kids? We bought kids coats, gloves, hats, boots, like Christmas toys. Like, we did it all, everything that people needed, washing powder, dishwashing liquid. We sent it out in all of their care packages. We sent out treats for the kids so that they would feel like they weren't missing anything. Like, they still got granola bars and chips and movie night and how to make a s'mores and the ingredients to make s'mores. And we produced a documentary because, hey, we needed to get around the fact that we had somebody in a high office that was literally putting out disinformation to our community. So we produced our own documentary and released it at a movie theater for free so people could see it. And then we put it online. Like, this was all hands on deck trying to make it happen. And that's what these other ladies have talked about also. We had to be on deck making it happen because we were the ones that saw the ship crumbling.
Mm-hmm.
Absolutely.
And everything
Absolutely.
closed around us, so we had to get out there. I mean, the food distribution lines where we distributed PPE and information. And so one of the things that I found with outreach, you just can't talk about COVID. You have to bring a tangible, touchable resource, whether that's food, whether that's PPE, whether it's, I don't know, whatever it is that you need in that community. That's also is an example of caring, just as much as giving out and passing out the information. That shows that, okay, you're thinking about me, you care about me, you recognize. And right now, I'll be honest with you, I am concerned about PPE. It's the fall of the year. It's time for pathogens to go crazy again. COVID is not gone. So the mass giveaways have dried up. And so you see people with crumbly up masks, something that's not an N95, just anything. And I think that we need to go back and look at that again and make sure that the people who can least afford a mask can get them. And it's time. And one of the things that people like to forget, some of the, not the group homes, some of the social, they call them social, like adult daycare for mentally ill. That was a good, we did some things there. Those that's an adult population mostly, and they overlooked a lot. So if you could just bring things into those environments, it helps a lot.
Thank you, guys. Listen, this is an awesome discussion, and we're going to stay on point. I want to keep it going. Let's just move on to the next slide to get through a little bit of this by 6:30. I think you all know this, that planning, organizing, and equipment is very, very important. Next slide, please. Let's look at another chat questions just to keep this dialogue going. So lessons learned, like what are some of, and you're saying it now, like Belinda, just saying now we need to regroup and we need to come up with these strategies to prepare for these emerging pathogens and centering the community. Let's keep the discussion going from these lessons. What are some ways to prepare in the future? Now, I found that when I talk around the country from our programs, there's a lot of official community, like the health department was in charge of a lot of resources, and these funders and the foundations, like Ms. Hall is talking about. What are some ways leadership can prepare now to get your stories out there and do better with these gatekeepers with the resources, for example? What y'all think?
I want to, yeah, I think I can jump in here. So I think one of the things that have actually probably even been referenced already has been in making sure that we have people at the table and we have impacted communities being a part of the conversation, you know, the nothing about us without us movement. I think it's super important for us to tie in and start asking those questions in terms of like, why does our reality look the way that it look? And a lot of what we need is systemic change. Like there are systems that, yes, we've heard the conversation that systems are broken, but we also have to realize that some systems are doing exactly what they've always been intended to do, which is why things look the way that they do. And I think that that's extremely important. You know, we talk about food access, like in a place or in a country with so much abundance and so much, you know, food going to waste, why do we still have people and children starving? I also think that, you know, making sure that we center community by treating community as people, and that's extremely important. I realize that, you know, that it's essential that we get accurate health information out, and that whenever we're doing outreach and doing door knocking, like we get this information out there. But at the same time, it's like there are things that need to be addressed prior to your agenda. You know, so it's like, yeah, maybe the information that you're trying to deliver is important and, you know, it's needed, but they're worried about how they're going to feed their children. So are you addressing their needs before you address your own? And I think that's extremely important, which is why I like that we were able to incorporate food access, because just earlier this month, we held a food distribution event, and in less than 3 hours, we were able to hand out over 21,000 pounds of food, you know, and we realized that not all of it goes, you know, with the people that are coming in through the food drive and us putting food in the back of people's vehicles, but, you know, the work that happens before and after, because we realized that unfortunately having a vehicle is essential, and though it is also a luxury. So not everybody can get to that food distribution event. So are you making sure that food is making it to the people that need it most? But I definitely want to say the systemic change is extremely important. And we've kind of been in survival mode here these last few years, but I feel like it's definitely time to continue tying it in and start asking those questions.
Yeah, I think one of the things too is like how can we, one thing that Belinda and Ms. Hall both pointed out is that I think these officials and these foundations make a lot of assumptions. For example, the Black church is the only way to get to the community. How can we build the channels of communication we have now, the representation that you've experienced now, and make sure it gets to the top? You know what I mean? Like, what are some suggestions, some different, Yesenia and Belinda and Ms. Hall have all mentioned how the real work happened, and how can the leaders now communicate this moving forward? You know, because I think one of the objectives today is to make these actions.
Yeah, I think the storytelling is extremely important. I feel like it's hard to argue with somebody's reality, because those are facts. That's somebody's story, that's somebody's experience. Whenever we start talking about emergency, you know, we realize one of the things that a lot of people don't know is that not everybody's home has a 911 address associated with the GIS system. So that's what they were like, oh, in cases of emergency, call 911. I'm like, but yeah, here I am at 3 o'clock in the morning helping EMS find a farm worker whose house doesn't have an address associated with it. And we know that time is essential, but those are some of the challenges that we still continue to face, and then we'll continue to face until it's addressed.
And I think rural, and I will say, because I live in a rural community, that the country is mostly rural. And I think all rural communities face similar challenges, like her 911 story she just told, or the distance between service and access, and all the things that make that work. But going back to your original conversation, in my mind, and I'm thinking that there has to be a coalition that is working now for the next event, and they can't be working in silos, and they can't just work. They have to not only work, but they have to be active in the community so that they become the trusted voices. And so when something happened, this agency, who's been out in the community working and everybody know about them, they are already trusted. And then people know, well, let's call them. And I say that because for the Roanoke Valley Breast Cancer Coalition, I know I don't sound like we should be talking about COVID, but we just kind of got thrown in there. I get it. But during the month of October, Breast Cancer Recognition Month, we get so many calls for acts for support, for service, for material, for anything, and that is because we're in the community all the time. And so when that day comes, they know who to call. And I just think that has to be the model for us moving forward, who to call. Because when this happened, Ghostbusters really happened. There was nobody to call. And so, you know, and that's when we got all that misinformation. I don't say that's when, but you know, I think because we didn't have anyone to call, misinformation just spread.
Yeah. Awesome. Listen, let's move on. That's perfect. We need to, these coalition-based, looking at the real leaders. Let's move to the next. Really quickly, we just have to get through about 5 more minutes of discussion. So obviously you guys have talked about action plans and preparedness. Let's move on to the next slide, please. So what are some effective ways government officials, institutions, and media respond to emergencies in an accurate way? So we're talking about like how did they get the message right sometimes? And how can these coalitions that you're talking about interact with the people in power? One thing we've heard about is getting people's stories out. What are you guys thinking? And just in closing,
I think effective coalitions are built with the community in mind. And those, whether they're hospitals or government entities, they're just part of the committee. So everybody have an equal voice.
Yes, very, very good. Next slide, please. Let's move on. So if we talk about recovering beyond the emergency, again, let's just next slide, please, Pat, because we just have a few minutes to close. How can we ensure that communities are in a better position before this for the next crisis? So I'm hearing some good voices here about getting leadership of these coalitions, making them visible, and communicating to the top. What y'all think? Just as our last little bit of discussion. Any comments?
I think that the education piece needs to be there. And like we've mentioned before, making sure that the people that are the trusted messengers, that are people that look like us, that are people that speak our language, needs to be in place, and it's something that has not been in place. I want to say that realizing, so one of the things that I want to definitely reiterate is that a lot of the challenges that we saw during COVID were not new. They were just exacerbated throughout the pandemic. But it's something that we've dealt with for many, many years now, and that we'll continue to deal with until they're addressed. I think that whenever we start talking about the healthcare crisis and like their role and what they have, you know, I don't know, I think it's just their role, and you know, what are some of the things that they did, or what are some of the things that they didn't do, and then willing to take on that feedback and realizing that unfortunately the way of doing things historically has not been accurate or not been the best way, and then being open to change and accountable, like, to communities. So I think that's extremely important. So like, are they asking some of those questions? One of the things that we saw during the pandemic is that they were not asking questions in terms of, for example, occupation and communal housing. So, you know, if somebody came up positive for COVID and they're a farm worker that's living in an H2A camp with another 300 guys, then yeah, you're not limiting the spread of COVID because you're not capturing that information and that data and responding accordingly. I think that's just where I'm at with that one. There was a lot of people that didn't go to the hospital because the message there was that if you went to the hospital, that's where you went to die. So, you know, acknowledging where the system has failed people and willing to make those necessary changes with an open mind is going to be essential to ensuring that we're prepared for the next healthcare crisis.
Absolutely. That's a great summary, Yesenia. And this is a good opportunity for us to come together today and to think about these coalitions. And let's give my thanks to the people from Respect, these regional centers, saying these are these resources here, and how do we act better as connectors? And I think just in this 20 minutes we had together, these stories you have are so important, and bringing these coalitions forward and educate up rather than being told and having the money trickle down. Let's open those channels and move in those directions. So I'm so sorry we're short on time, but I'm just trying to pass it over to my colleague Sharice now to close. And thank you so much for these. This is my timer. Here we have a community action plan and strategies. And so I'm just going to turn it over to my colleague to close it out. And thanks again for your sharing today. It was just awesome. Thank you.
Great, thank you. And thank you for that enlightening conversation, having new thoughts, and that engagement that that just happened. It was truly amazing, and I appreciate everyone who engaged in the process, who gave us new ideas. We can bring this back to not only CCPH, but to the UNC team as well, as they start with their respect sites and start to engage with communities before, during, and after a crisis. And so we want to, so if you have any feedback on the forum or any general questions, you can reach us at feedback@ccphealth.org. And then for the post-forum evaluation, please take the next 2 minutes to complete this short evaluation. The first, I would say now this is short, smaller crowd, but everyone who completes the evaluation will receive $75. And then for the guest speakers, we'll have something else for you guys, but please still fill out the evaluation. So we're going to have a few minutes just to give you some time for that and make sure that you can access it. So please let us know if you can at least access the evaluation that was just put into the chat.
I got it.
Got it? Okay. So at least it's accessible. Okay, great. Thank you so much for that. And then, yeah, lastly, it's just thank you guys for participating in this community forum. Thank you to the guest speakers who came out and just shared about your organization and thoughts along the process of emerging pathogens and just emergencies in general, and how we need to center community and equity and partnerships when facing these battles. So please share with your networks. Our last community forum is on Wednesday from 5 to 6:30. Yeah, share with your networks. We'd love to see another turnout. But I wanted to say thank you again for coming out this evening and spending an hour and a half with us. So if you guys have any questions, please feel free to email me or the feedback@ccphhealth.org if you have any questions, and I will follow up with the guest speakers after this. So thank you guys so much and take care.